We are here today with a special guest, Dr. Pupper McPupperson, and she's going to show us how to draw some labs. Get it? Labs. High five! Let's do this. This is your butterfly needle. You notice it does not have a vacutainer attached to it. That's what this thing is. Or it might look like this, where it already has one pre-attached in the packaging. Let's go ahead and open them up. You see this one, this is the butterfly right there. It comes with a vacutainer in the package. So if you have to attach it, you just simply put these two pieces together and screw it. So now it's attached, vacutainer, butterfly. You might see these ones in the hospital. This one does not come with a vacutainer. It's just the butterfly. So we have one here. You would stick this part into the hole and screw it on. And this is what we're going to be using to do our lab draw. So now you're going to look at the arm and try to find a vein that you want to try and stick. So you can always try and go for the ones in the antecubital, those two right there, that you can see them, you can see them pretty well. If you can't find one, you can also have the patient squeeze their hand. Sometimes it helps have the veins pop out. There's also a good one right there on the forearm that you can stick, so you don't always have to go for the one in the antecubital. So you're gonna just look around and find one that you think you want to stick. You're gonna want to avoid anywhere where there might be any lesions or scar tissues, scabs, or any other abrasions. I don't have any, but if I did, like there's a scar right there, you would try not to stick anywhere over top skin like that. So find a clean area that's intact skin and go for it. So I'm seeing two really good options, one on the forearm and one in my AC. And then there's my husband and his veins. Every nurse's dream. Look at that. Amazing. As you're testing and looking for a vein, you can use your finger to kind of test them. You can see this one, it's springy like a trampoline. As you press on it, it recoils. This one over here as well, you can see as you press on it, it presses in. You know, this is a good vein. If it doesn't bounce, I wouldn't go for it probably. So I've seen this one here is pretty good. You can see that right there, this long vein right there. Or there's a good one right there too. And there's also one in my AC. You can see that one right there. So you can use your ungloved finger to test, but once you've cleaned the area, you can't touch it again with an ungloved hand because then you're just undoing the cleansing you did. So as you're testing and looking, you can use an ungloved finger, but after you select that vein and after you cleanse with your alcohol, you can no longer use your ungloved hand. You have to put gloves on. After you find the vein and select the one you want to go for, it's time to apply the tourniquet.
If you're right-handed, I usually will put a smaller piece on my right side and the longer piece on my left side. If you're left-handed, then you'd put the reverse. You'd put the smaller piece here and the longer piece over here on the right side. But again, I am right-handed. What you're going to do is with your left hand, you're going to take two fingers and your thumb and grip the tourniquet, leaving at least a few inches of the end piece visible. I'm going to pinch it. I'm going to put my two fingers resting on the bicep right here in the midpoint, 3 to 4 inches above the site. My right hand grabs underneath and I'm going to get tension here, 2 fingers and a thumb. I'm going to pull up with my right hand on the longer piece, over, pinch it with my thumb, keeping my fingers attached to the bicep. I should have good tension right here. If I don't, then that means I'm doing it wrong. Once I lift up, I'm going to tuck the back end in and have a nice 3 to 4 inches above the site with a nice little release lever right here. I put the long piece here because this tells me this is the piece I'm going to pull to release my tourniquet, not the small piece. So I have the long piece here and it's ready to go.
After you've applied the tourniquet, have the patient make a fist. Again, this will help the veins to pop out a little bit. Now that you've selected your vein and you've got your tourniquet in place, it's now time to cleanse the area using your alcohol prep pad. Now's the time to put on gloves if you haven't already, so that you're not touching the skin with your plain ungloved hand after you clean it. So I'm gonna get my alcohol swab, clean the vein that you're going for. So I'm gonna go for that one right there. And yes, I'm gonna attempt to do it on myself one-handed, so we'll see how that goes. To cleanse the area in circular motions. And then when you're done, wait for it to air dry. Okay, so you can still see that it's shiny because it's still wet. Don't blow on it and don't fan it with your hand. Just wait for it to air dry. Okay, now you're gonna get your butterfly. There's a couple ways to hold it. You can hold it by the wings, which are these two blue things. That's what they call it, the butterfly. You can hold it and scoop it like that, or you can hold it by the yellow and go like this. Kind of just whatever your personal preference is. I like to hold it by the yellow. So you're gonna take off the needle cover and try to hold it bevel up, so the slanty side. You're gonna insert it at a 30-degree angle. So this is 90, half is 45, so less than that, 30, almost as straight across as you can. Have your tubes ready nearby so that you don't have to reach for them far away after you get some flashback. Normally, if you had two hands, you would use one hand to hold the vein in place with your thumb like this, and then use your other hand to insert your needle there. But I don't have another hand, so we're gonna just see how this goes. Insert 30 degrees. Ha! Okay, so let me grab this. You can see inside the yellow there's blood. Okay, so I'm gonna grab, it's okay to let go of it once it's in there. Grab your tube. Simply pop it on. So as you're drawing the blood and you're popping the tubes on, it matters what order you do it. So refer to the reference guide on which order of draw you do. So as you're filling up as a tube, it's one fills up, take it out, pop another one. The vacuum will just fill it up. Make sure you're doing it in the correct order because there's different enzymes and chemicals inside that if mixed will mess up the different tubing. And you can see it's slowly going up. If you kind of wiggle it around a little bit, sometimes it'll realign better. Come on. There it goes. When you've got your blood in your tube, you're gonna get your gauze. Get that ready. You're gonna take off the tourniquet, pull out the needle, and cover the spot with the gauze and put pressure on it till it stops bleeding. After you're done holding pressure, you can apply a bandage or you can leave the gauze there and grab a piece of tape and just kind of put the tape over there to keep pressure on it. To remove a tourniquet, simply take your end, the end that's attached to the loop, and just pull, and it's a quick safety release. Notice if you try to pull the wrong end, nothing happens. So that's your first clue, it's not the right end. If you pull the correct end, it should just pop right off. Right after you take the needle out, make sure that you throw the needle in the sharp. So you can ask the patient to hold the gauze down for you for a second while you take the needle and dispose of it. A good way to protect yourself is to grab the end like this. So one hand on the tubing, another hand on the yellow, and then pull and slide up like that. You'll notice that the needle gets covered to prevent any needle sticks. Put this in the sharps container, and then you can proceed to resume holding pressure. Next, we are going to throw away our trash. We have quite a bit of it. I like to use my gloves hands because you don't want to pick up things like that with ungloved hands. Take it all, and then you can do the glove method. If you take all your trash in one hand, then you can remove your glove like that, and the trash should stay inside the glove. Okay, now we have our tubes of blood ready to go. We want to make sure we verbalize that we're going to put our patient label on them with our patient's information and the time, and then we're going to prepare them in the baggies and have them shipped down to the lab. So you're going to want to put them in the biohazard bag. The tubes will go inside here, inside the Ziploc part, and then your requisition forms, they can go in this outside pocket, so it's a different pocket than the Ziploc pocket. So that's where the tubes would go, and then you can put the paper right in there, like this, just to keep the paper clean, just in case there's any extra blood, to keep it from getting spilled. So that's how you would send it and ship it down to the lab. Last but not least, you want to make sure you document which labs were drawn. So you would say, I drew an H&H and a CBC on my patient, the site from which it was drawn, so I drew it from the patient's left forearm, and the time that it was drawn and sent to the lab, so 1400, so they know how old the blood is in the tube. And after that, you are done. You know how to do a venipuncture.